I'm going to show you the rhythmic bouncing movement technique. That's side lying with hips bent 90 degrees right here and the knees bent 90 degrees. You want to be that the person's comfortable. So we're on a yoga mat, on a carpet. If it's a bed, that's fine as long as they're comfortable and you can get the bouncing that we're looking for. Otherwise, you might have to adapt your technique a little bit. So the goal is that we're trying to get a nice little bounce all the way up through the spine. So it's very vertical, okay? There's no rotation to this one. So I'm gonna put my hand on Hayden's sacrum. So right here, that bone on the bottom. You can go both sides of the hips as well. Whatever works comfortably for you and for the patient. You both have to be relaxed in doing this. My goal is to make it so that there's nice little bounce from down to up. That kind of just goes through the whole spine. It's very good for the cerebrospinal fluid that's going up and down that spinal cord. It's very relaxing to the paraspinal muscles. It's very calming to the nervous system. So if it's not those things, if it's not calming to you, you're not doing it right, okay? So you're both comfortable. I'm going to adjust my position a little bit. Okay, so make sure you can see here. So I'm going to start, let's see where we get this going for Hayden. So little people are going to take less. It might be easier just to do the one hand. Hayden's a little bit bigger, so I'm going to go from both ischial tuberosities, those two bones right in here. Just really gentle. You can see that I'm not actually putting a lot of effort, but there's a decent little bounce. You can see that little gentle jostling going back and forth. I'm going to maintain that consistently. I'm not going to stop and start at all. That's not rhythmic bouncing. You got to pretend like you're hitting a ping pong ball back and forth. There's no stopping and then hitting the ping pong ball. It's a bounce, 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 but only one person. So you're just gonna go up and up and up and up, and you're gonna do that very gently. Does that feel okay? Yeah, so he's nodding. I like to check in, make sure that it feels calming to the person. We might go for 30 seconds, maybe 45, maybe 60 seconds checking in. You can often, though, as you're kind of doing it, if it's working really well, you can see the person just kind of taking a deeper breath. Or they're softening within their muscles. You'll get a little bit more comfortable the more. Oh, there's Hayden's big sigh. That was totally forced, but we'll take it. Good acting, Hayden. Although he does feel very relaxed, so maybe it was real. So you only do that for as long as I'm probably telling you or your therapist is telling you. Might be 60 seconds. It might be a little bit longer, depending on how far along in your treatment regimen you are.